in children do have problems with hearing due to fluid buildup behind the eardrum. And fortunately, most kids recover on their own from that hearing loss, especially when they have a cold. If you notice, when you have a child that has a blocked nose and cold, their hearing is not as good as it should be. And during that time, it's likely that they have fluid behind there, not because they're being naughty, but they can't hear because there's fluid behind the eardrum, which is one of the reasons why the ventilation tube that designed is in use, because it's usually children that require it to help them through the time if that fluid does not settle on its own. Because the only time when they need treatment is if it persists for 3 to 6 months rather than clear, because obviously that will have an impact on their learning skills and communication skills. So it may well be that they had a genuine problem which was ignored or resolved by the cane, because in my days it was the cane or else.
Why didn't you answer? I've been calling you.
Yes,
and the child didn't even hear.
The child didn't hear, and it may well the child genuinely did not hear.
Yeah. Okay, so let's talk about that. Addenbrooke's Owa grommet, a tiny ventilation tube for the treatment of middle ear disease, also known as glue ear.
Yes.
So what is glue ear? I think that's a good place to start.
Glue ear basically is accumulation of fluid behind the drum. This is usually a response to reduced pressure, because normally when you have the ear, the pressure within the middle ear should be the same as the pressure on the outside, which is why the good Lord, because he knew it's going to be a closed tube, put a communication between the back of the nose and the ear, which is one of the reasons why ENT is linked, because there's a tube that when you open your mouth or you swallow it or you blow your nose, opens up and allows air to get into the middle ear space. And it's very important for you to be able to hear. When there's a reduced pressure, the drum gets sucked in. And sometimes the lining of the ear reacts, if it can't get air in, by producing fluid from the lining to try and push the drum back out. But it doesn't work because it now stops the middle ear bones from moving around, hence the hearing loss. So the fluid remains, and it can actually happen in adults, and that's the reason why if the eustachian tube is not working well in an adult, when they're flying the plane, when the plane is coming down, they have a lot of pain or they feel that they're deaf. It's related to the same thing because the pressure changes. When you go up, the pressure changes in such a way that the pressure increases in the middle ear, which doesn't affect your hearing. But when the plane is going down, it's supposed to let it down. You just have a change in pressure change, and you now have a reduced pressure in the ear. And if the ear is not able to compensate for it, the patient starts having pain, and in some cases the eardrum can burst, which is one of the reasons why it's not a good idea to get on a plane if you've got a very blocked nose.
Pause.